Hi, Adrian.
Hi, great to be back.
Thanks for coming around. Before we get into specific questions, I would like you to share your background and a brief history and how your life has evolved and your purpose has evolved.
Yeah, so I've only ever worked in healthcare. So I went to uni and did a physio degree at Curtin Uni and worked as a physio in quite a pretty short career. I only worked for 3 years as a physio and then moved into some management roles. I was working in Anglicare, Southern Queensland at the time, living in Queensland, which was great. And that was aged care and disability, and really enjoyed the challenge of management, and then moved back to Perth in 2012 and started at Richmond Wellbeing then as an executive, and then 3.5 years ago moved into the CEO role. So for me, I've always been in roles where I've found a real purpose and a drive and alignment with values. I guess that's what I think attracted me to healthcare in the first place, was doing something that makes a difference in people's lives and also the community. And look, I know that it's very easy, say in a role like mine, or if you're a teacher, these sorts of roles, very easy to say, here's the purpose and the reason why you do it. I know there's other people find purpose and drive in a great varied roles, but for me it was really quite simple, helping people. And often at Richmond Wellbeing, in many instances, when we start to care for people, it's at one of the lowest times in their life. And then we work with people over, in some instances, many years to assist them in their recovery journey. And then some people continue staying with us or they go back to living in the community independently. Yeah, very purpose-driven in what I do. I need to be in a role and at an organisation where I feel like I'm actually making a difference to the community.
And have you seen across your working career, there were when you might not be purpose aligned with the organisation you were working with, and how these situations panned out?
Yeah, look, I've been pretty fortunate. I guess probably the only time I didn't really feel a strong alignment was when I was working in a private hospital. Okay. And we were still able to provide great quality care for people, but obviously there are some instances in private hospitals where the primary drivers can be length of stay, which is all linked to dollars and funding. And obviously I live in the real world. Things need to be financially viable, but yeah, that was probably the only time where I sensed this is not an alignment to me, because I think the best outcomes in the care of the patient needs to be number one. And I think in those settings, it can lean itself to having a little bit too much focus on the numbers and the figures and the outputs and the throughput and all these sort of things.